Dr. John Robinson from Oklahoma Men's Clinic. We're going to talk about everything we do right here in this very, very short video. Hold on, here we go. Comprehensive hormone replacement therapy. The first and foremost, we're going to check your levels. We're going to understand testosterone levels. We're going to make sure we have testicular support through things like clomiphene. We use this all the time. We're going to check your DHEA levels. And if that's low, that's going to be enhanced, and that will help with your libido. It helps with recovery. We look at nandrolone. This is one of the most powerful hormones you can add in with testosterone. This is helping to further enhance muscle. It definitely helps with arthritic pains. And then finally, human growth hormone. We're going to measure those levels for sure. This helps with sleep recovery. It's an anti-aging hormone. We can use this either as peptides like tesamorelin, sermorelin, or actual omnitrope and human growth hormone. Putting it all together comprehensively, that's the way we do it. The sexual wellness options all in one spot here: mild, moderate, severe ED. For mild ED, we're going to look at enhancing blood flow through sildenafil, tadalafil, vardenafil in a very, very special lozenge. We also have PT141 and oxytocin in a lozenge. This enhances orgasm. Nitric oxide levels that we measure for you and professionally replace that. And of course, hormone replacement therapy that we just talked about. If we need to go further, we have acoustic wave, the classic P-shot, additional peptides, and then even trimix in severe situations to really, really guarantee erections, virtually guarantee erections. We can also make the penis bigger with our classic program called Elongate. What do women prefer, guys? Somewhere between 6 to 7 inches, 5¼ to 5½ inches in girth. This is a 2015 study that I'm always citing. This is definitely what is ideal for most women, and we can certainly help with this. This Elongate program is giving 6 different P-shots once a month over 6 months, nitric oxide, a vacuum pump, and a Restore X penile extender, all of which can help to increase. This is an example of a 50-year-old male who got just about an inch in length and an inch in girth. We have treatments for premature ejaculation. There's definitely answers for that. Testosterone therapy definitely helps just with confidence in and of itself for guys. Duloxetine is a fast-acting SSRI medication that's pretty classic, and we know how to use that particularly. We can also just give you things like Cialis, Viagra, Levitra in a low dose, this fast-acting lozenge that we always use, but low dose can go a long way. Same thing with this trimix. Just a little bit of trimix can go a long way to make sure that even after ejaculation, you're still erect. Peptide therapy. Look, there's this, we've been doing this for a long time. There's many, many different peptides out there. And we certainly understand there's peptides for sexual wellness. There's some of them here. We've already talked about them. Growth hormone stimulation. We have peptides for weight loss, semaglutide, tirzepatide. You've heard of those likely. We have all of those answers. Mitochondrial-derived types of peptides is helping with your energy. There's peptides for your brain. There's peptides for exercise recovery, and we focus a lot on that. Tissue repair and regeneration. BBC 157, perhaps you've heard of. Hair growth. And we have answers for that from a peptide standpoint. A really fantastic cardiac peptide called vasoactive intestinal peptide, immune stimulation, and other GI, gastrointestinal type of peptides. We do it comprehensively. We can help find the ones that are going to work best for you. So again, comprehensive approach with peptides, 10 years of prescribing. I've been doing this for years. Pharmacy grade, not this research online garbage that's out there. And it's definitely more than just the basics. As you saw, we have dozens of them, and we're constantly adding these things on. Regenerative medicine is stem cell therapy for your joints. Know that these technically are not FDA approved. We can get into that more when you come and see us. But know that with what we're using here, I always let people know that the high quality, these are American Association Tissue Bank certified. If the stem cell products out there aren't doing that, then they're just not worth it. UFC uniquely uses the company that we use. We really, really can improve pain scores dramatically, knees, shoulders, hips, back, neck. And again, it's a comprehensive approach. What we're doing for this stem cell regenerative joint injection approach. We're going to look at hormones. We're going to look at these other peptides. We have acoustic wave therapy that's part of the rehabilitation for you if you decide to do one of these types of stem cell therapies. So we're putting it all together for you guys, all the way from hormones to sexual wellness to peptide therapy and ultimately into regenerative joint injection. There you go. I did it in 5 minutes or less. That's the whole thing, guys. Come and see us quick.